You are performing a pre-participation sports screening on a previously healthy and very athletic 14-year-old girl who plans on playing soccer. On questioning, there is no history of chest pain, syncope, or shortness of breath. Family history is negative for early cardiovascular disease or unexplained sudden death. On exam, height and weight are at the 60th percentile, blood pressure is 110/74. Pulses are present in all extremities. No murmurs. Lungs are clear. However, her pulse at about 70 beats per minute is irregular, with an occasional skipped beat. ECG shows occasional uniform premature ventricular contractions. You have her run outside for 3 minutes. Afterward, her rhythm is regular and no PVCs are noted. QT interval is normal and there is no ventricular hypertrophy. Which of the following management plans is correct given this patient's history, physical exam, and ECG findings? Option A. Start the patient on oral propranolol and clear her to play soccer only after elimination of the premature ventricular contractions is documented on repeat ECG. Option B. Clear the patient to play soccer without restrictions. Option C. Restrict the patient from playing soccer and advise her to take up a less intense sport such as archery. Option D. Start the patient on oral flecainide and clear to play soccer only after elimination of the premature ventricular contractions is documented on repeat ECG. Option E. Restrict the patient from playing soccer, pending the results of an echocardiogram. Take 10 seconds. Uniform PVCs that disappear with exercise in a completely healthy teen. What does that tell you? The correct answer is B. Clear the patient to play soccer without restrictions. What we have here is a perfectly well 14-year-old girl with uniform PVCs, same size and same shape, that disappear completely with exercise. By history, exam, and ECG, there is absolutely no evidence of underlying heart disease. PVCs are very common in children and teenagers, and they are virtually always benign. When PVCs disappear with exercise, meaning they go away as heart rate increases, this strongly suggests they are benign. Options A and D are wrong. Starting propranolol or flecainide is completely unnecessary and likely to cause more harm from side effects than any benefit. Option C is wrong. There is absolutely no need to restrict her from soccer or redirect her to a less intense sport. Option E is wrong. An echocardiogram is not necessary in this patient, given the absence of any signs or symptoms of underlying heart disease. It would virtually always be normal. You would refer to a pediatric cardiologist if she had symptoms like lightheadedness or syncope, a heart murmur, PVCs making up more than 10% of beats, or PVCs of varying morphology. Key testing.